Vision is a result of the interaction between different parts of the eye and the brain. The quality of vision depends to a high extent on the performance of the natural lens, also called a crystalline lens. This transparent and flexible body is located in the capsular bag behind the iris and is held in position by zonular fibers. In a healthy eye, a clear and bright image can be seen when the light rays pass unhindered through the crystalline lens and focus directly on the retina at the back of the eye. With age, the crystalline lens becomes thicker and less transparent, preventing light from passing through. This clouding of the crystalline lens, called a cataract, leads to a gradual deterioration and, if untreated, to a complete loss of vision. The only effective way to treat cataract is to remove the clouded natural lens and replace it with a clear implant, a so-called intraocular lens, IOL. Cataract surgery is one of the safest and most common surgical procedures worldwide, performed generally on an outpatient basis. The surgery is carried out in the anterior part of the eye that consists of the sclera, cornea, iris, and the crystalline lens. The surgical procedure normally takes between 15 to 30 minutes and is pain-free. In general, local anesthesia is used. The most common form are eye drops applied directly to the eye prior to the surgery. First, the surgeon makes a main incision of about 2 mm at the junction between the cornea and sclera. The intraocular lens will be inserted through this incision. Then 1 or 2 additional microincisions are made to enable the manipulation with surgical instruments. Next, the surgeon applies a jelly-like transparent substance called ophthalmic viscosurgical device, OVD, inside the interior chamber. This substance protects the internal structures of the eye and creates space for the surgeon to manipulate with the surgical tools. Then, the surgeon carefully opens the capsular bag where the lens is located and creates a round, continuous opening of approximately 5.5 millimeters. This opening allows removal of the cataract lens without removing the capsular bag. Using an ultrasound probe, the cloudy lens is broken down and gently removed via suction, leaving a clear capsular bag. The red color that can be seen after the removal of the cataract lens is a result of the reddish-orange reflection of light from the eye's retina. Finally, the clear artificial lens is implanted using an injector. The intraocular lens unfolds gently into the capsular bag, replacing the removed natural lens. The implanted intraocular lens stays fixated and centered in the eye and is neither visible nor perceptible. The incisions are self-sealing. The IOL provides the main functions of the natural, healthy lens, enabling the patient to see clearly again at one or more distances. Modern IOLs, such as trifocal lenses, provide good vision at near, intermediate, and far distances, giving patients a high chance of no longer requiring eyeglasses.